Picture someone who looks by every outward measure completely healthy. They are in their early 30s, they go to work, they laugh with friends on the weekend, they might even hit the gym twice a week and tell themselves that counts as taking care of their health. Nothing about their appearance suggests anything is wrong, and yet somewhere underneath that ordinary-looking exterior, a slow and largely invisible process may already be underway, one that will not announce itself with pain or panic, one that will not show up on a mirror or a scale, and one that most people never think to check for until something forces the issue. That is the strange and unsettling nature of high blood pressure, and it is why this particular health condition deserves far more attention from younger adults than it usually gets. There is a version of this story that plays out quietly in millions of homes every single day, and it usually starts the same way. A person in their 30s wakes up feeling almost fine. Maybe there is a dull ache behind the eyes. Maybe the heart skips a little on the way up the stairs. Maybe the room tilts for half a second when standing up too fast. None of it feels serious enough to mention to anyone. It gets blamed on a bad night of sleep, too much coffee, too much stress at work, or simply getting older. Life moves on the same way it always does, until one day it does not, and a doctor says a phrase that changes everything. Your blood pressure has been high for a long time. This video is about the 3 symptoms that most people in their 30s and beyond quietly ignore, the reasons they get ignored, and what they actually mean for the body underneath the surface. High blood pressure has earned a nickname among physicians that sounds almost too dramatic for something so common, the silent killer, and the reason for that name is simple. In the vast majority of cases, elevated blood pressure produces no obvious symptoms at all. The body does not send a clear alarm. There is no flashing light, no sudden pain that forces a person to stop what they are doing and seek help. Instead, the pressure inside the arteries rises slowly, sometimes over years, quietly reshaping blood vessels, straining the heart, and wearing down organs that depend on a steady, gentle flow of blood to function properly. By the time symptoms become impossible to ignore, the condition has often been present for a long time already. What makes this especially dangerous for younger adults is a shift that has happened over the last few decades. High blood pressure used to be thought of as a problem for people in their 60s and 70s, something that came with retirement, gray hair, and decades of wear and tear. That assumption no longer holds. Modern life has changed the equation. Diets built around processed and packaged foods deliver enormous amounts of sodium without people realizing it. Office jobs and long commutes have replaced physical labor with hours of sitting. Sleep has been pushed aside in favor of screens, notifications, and late nights. Chronic stress, once considered an occasional visitor, has become a constant companion for many people juggling work, family, and financial pressure. All of these factors quietly push blood pressure upward, and they start doing it far earlier in life than most people expect. A person can be 32 years old, exercise occasionally, and still be walking around with blood pressure numbers that would alarm their own doctor if they were ever actually measured. The first warning sign that tends to get dismissed the fastest is a particular kind of headache. Not every headache means anything, and most of them are harmless, caused by dehydration, tension, or simply staring at a screen for too long, but there is a specific pattern worth paying attention to. It often shows up in the morning, sometimes even waking a person up, and it tends to sit at the back of the head or press around the temples like a tight band. It is different from the throbbing, one-sided pain of a migraine, and it does not usually come with the sensitivity to light that migraines bring. Instead, it feels like pressure, a dull and persistent weight that lingers for a while after waking and then fades as the day goes on. Because it fades, because it is not sharp or dramatic, it gets written off almost immediately. People assume they slept in the wrong position, or that they need more coffee, or that they are simply tired from the week. What is actually happening in many cases is that blood pressure rises overnight and into the early morning hours, a pattern doctors refer to as a morning surge, and the blood vessels inside the skull are reacting to that pressure. A headache that keeps returning in this same pattern week after week is not something to explain away. It is worth having measured literally with a blood pressure cuff rather than guessed at. There is also a version of this same symptom that shows up not first thing in the morning but later in the day, after long stretches of stress, tight deadlines, or emotionally draining conversations. It can feel like a tightening band around the entire head, sometimes accompanied by a strange warmth in the face or a subtle throb behind the ears that seems to sync with the heartbeat. People often reach for painkillers, and the painkillers usually work, at least for a while, which only reinforces the idea that nothing serious is going on. But painkillers treat the discomfort, not the underlying pressure inside the blood vessels that produced it in the first place. Masking a symptom is not the same as resolving its cause, and a headache that responds to medication but keeps coming back on a predictable schedule is still worth mentioning to a doctor, especially if it lines up with periods of poor sleep, high sodium meals, or unusually stressful weeks. The second warning sign involves vision, and it is often the one that frightens people the most once they understand what is happening, precisely because it feels so unrelated to blood pressure at first glance. It can show up as blurred vision vision that comes and goes, a strange sensitivity to bright light, small floating spots that drift across the field of view, or a heavy, pressing sensation behind the eyes that feels almost like sinus pressure, but sits in the wrong place to actually be sinus-related. Some people describe brief moments where their vision seems to dim slightly, almost like a camera adjusting exposure, before returning to normal a few seconds later. These symptoms get blamed on everything except the real cause. Too much time on a laptop, old glasses that need a new prescription, allergies, being overtired. The truth is that the eyes contain some of the smallest and most delicate blood vessels in the entire body, and they are extremely sensitive to changes in pressure. When blood pressure stays elevated for a sustained period, those tiny vessels in the retina can become damaged, a condition called hypertensive retinopathy. In its early stages, it produces exactly these kinds of vague, easy-to-dismiss visual disturbances. In its more advanced stages, it can cause lasting damage to eyesight. An eye doctor can often spot the early signs of high blood pressure simply by looking at the back of the eye, sometimes before a person has ever had a proper blood pressure reading taken. This connection between the eyes and the circulatory system surprises most people the first time they hear about it, largely because vision feels like such a separate, self-contained sense, disconnected from anything happening in the chest or the arteries. But the eye is essentially an extension of the nervous and vascular systems wired directly into the same network that carries blood throughout the rest of the body. A slight change in pressure that would go completely unnoticed in a large artery in the leg or arm can produce a noticeable visual symptom in the eye simply because the vessels there are so small and so close to the surface. This is part of the reason many eye care professionals now ask about blood pressure history as a routine part of an eye exam, and why a sudden change in someone's glasses prescription or a string of unexplained visual complaints sometimes leads to a referral back to a general doctor rather than a stronger set of lenses. The third warning sign is the one that gets confused with ordinary life the most often, because on the surface it looks exactly like ordinary life. It is a combination of unusual fatigue, a racing or pounding heartbeat, and breathlessness that shows up with activities that never used to cause it. Walking up a single flight of stairs and feeling the heart hammering afterward, carrying groceries from the car and needing a moment to catch a breath, lying in bed at night and suddenly noticing the heartbeat, strong and insistent, almost as if it is trying to get attention, feeling drained by early afternoon despite a full night of sleep with no clear reason for the exhaustion. All of this gets attributed to being out of shape, being busy, being stressed, or simply getting older, and sometimes those explanations are perfectly valid. But when blood pressure is chronically elevated, the heart is forced to work harder with every single beat, pushing blood against resistance that should not be there. Over time, this extra workload causes the heart muscle to thicken and strain, a change that produces exactly these symptoms: tiredness that does not match effort, a heartbeat that feels louder and faster than it should, and shortness of breath that shows up sooner than it used to. It is the body's way of saying that the engine is working overtime even if the person behind the wheel has no idea why. What makes this third symptom particularly easy to overlook is how naturally it blends into the ordinary rhythms of adult life. Everyone feels tired sometimes. Everyone has stressful days that leave them drained by the afternoon. Everyone occasionally feels their heart pound after a strong cup of coffee, a stressful phone call, or a startling piece of news. The difference lies not in any single instance of these feelings, but in the pattern over time. A heartbeat that feels unusually strong on one stressful afternoon means very little. A heartbeat that feels unusually strong on a regular basis, even during calm, uneventful moments, sitting quietly at a desk or lying down at night with nothing in particular on the mind, is a different story entirely. Similarly, feeling tired after a genuinely exhausting week is normal. Feeling tired after an ordinary week with no clear explanation and no improvement even after a full weekend of rest is worth paying closer attention to. The body is remarkably good at adapting to gradual changes, which means a person can slowly grow accustomed to a slightly elevated resting heart rate or a slightly lower energy baseline without ever consciously noticing the shift, simply because it happens slowly enough to blend into what feels normal. The reason all three of these signs slip past so many people is not carelessness. It is the design of the condition itself. Each symptom on its own has a dozen harmless explanations. A headache is just a headache until it is not. Blurry vision is just tired eyes until it is not. A racing heart is just too much coffee until it is not. Nothing about any single symptom demands urgent attention, and that is exactly what makes high blood pressure so effective at hiding in plain sight for years at a time. It does not announce itself. It waits. What makes the situation more urgent for anyone in their 30s or 40s is a simple but often overlooked fact, which is that routine health checkups tend to become less frequent once a person moves past their 20s and settles into a busy career and family life. Blood pressure often only gets checked at a doctor's office during a specific visit, or sometimes not at all for years. If a person feels generally healthy and has no reason to seek medical care, that gap in monitoring is precisely where hypertension does its quiet work, unnoticed and unmeasured for years on end. Left unaddressed, chronically high blood pressure does not simply sit still, it actively reshapes the body over time. time. The walls of the arteries, which are naturally elastic and designed to expand and contract smoothly with each heartbeat, become thicker and stiffer under constant pressure, a process that reduces their flexibility and makes the entire circulatory system less efficient. The heart, forced to pump against that added resistance, gradually enlarges and weakens, increasing the risk of heart failure over time. The kidneys, which rely on a delicate network of small blood vessels to filter waste from the blood, can suffer permanent damage, sometimes progressing toward chronic kidney disease. The brain, dependent on a steady and well-regulated blood supply, becomes more vulnerable to both stroke and the kind of gradual cognitive decline that used to be blamed entirely on aging but is now understood to be closely linked to long-term vascular health. None of this happens overnight. It happens gradually, silently, across years, which is exactly why catching the warning signs early matters so much. One of the most persistent misconceptions surrounding this entire subject is the belief that a person would simply know if their blood pressure were high, that the body could not possibly let something so significant slip by unnoticed. It feels intuitive to think that way, and it is completely wrong. Blood pressure has no nerve endings dedicated to reporting its level directly to conscious awareness. There is no internal gauge, no dashboard warning light built into human biology. The only symptoms that ever appear are indirect consequences, like the ones described in this video, and even those only tend to show up after blood pressure has already been elevated for a meaningful stretch of time. Many people who are eventually diagnosed with hypertension report, looking back, that they felt completely normal for months or even years leading up to the diagnosis, aside from a few things they had long since dismissed as unrelated. This is precisely why relying on symptoms alone, rather than an actual measurement, is such a risky approach, and why so many doctors describe hypertension as a condition that is easy to have and remarkably easy to miss at the same time. Another common misconception is that high blood pressure is purely a matter of family history, something a person either inherited or did not, with little room to influence the outcome either way. Genetics do play a real role, and a strong family history of hypertension does increase the likelihood of developing it. But genetics are far from the whole story. Two people with the exact same genetic background can end up with very different blood pressure readings depending on their diet, their activity level, their stress management, their sleep, and their exposure to tobacco and alcohol. This is actually good news, because it means the condition is not simply something to be endured or accepted as inevitable. It responds to changes in behavior, sometimes quite quickly, and the earlier those changes are made, the more room there is to prevent the kind of long-term vascular damage described earlier in this video. The encouraging part of the story is that high blood pressure, especially when caught in its earlier stages, responds remarkably well to consistent, manageable changes. This is not about drastic overnight transformations or extreme measures. It is about small, sustainable habits that add up. Reducing sodium intake makes a measurable difference, and the biggest source of sodium in most modern diets is not the salt shaker on the table, but the sodium hidden inside processed foods, packaged snacks, canned soups, deli meats, and restaurant meals. Simply becoming aware of where sodium is actually coming from allows most people to reduce it significantly without feeling deprived. Increasing potassium-rich foods such as bananas, leafy greens, beans, and sweet potatoes helps balance sodium's effect on blood vessels. Regular movement, even something as simple as a brisk 30-minute walk most days of the week, has been shown repeatedly to lower blood pressure meaningfully over time. Prioritizing sleep, treating it as a non-negotiable part of health rather than something to sacrifice for productivity, gives the cardiovascular system the recovery time it needs each night. Managing chronic stress through whatever method genuinely works for an individual, whether that is quiet time, movement, breathing exercises, or simply setting firmer boundaries around work, reduces the constant low-level strain that keeps blood pressure elevated. Limiting alcohol and avoiding tobacco both remove significant, well-documented contributors to hypertension. And perhaps most importantly, checking blood pressure regularly, using an inexpensive home monitor or a visit to a local pharmacy turns an invisible number into something visible and trackable, something that can be watched and responded to long before it becomes a crisis. None of this is meant to cause alarm for its own sake. It is meant to close the gap between what the body is quietly signaling and what actually gets noticed and acted on. A headache that keeps returning in the same pattern. Vision that blurs or dims in ways that do not have an obvious explanation. A heartbeat that feels louder, faster, or more noticeable than it used to, paired with a tiredness that does not match the effort behind it. None of these things guarantee high blood pressure on their own, and only an actual reading taken with a proper cuff can confirm what is really happening inside the arteries. But these are exactly the kinds of signs that deserve 5 minutes of attention rather than a shrug and an assumption that everything is fine because nothing feels dramatic enough to worry about. The body rarely raises its voice before it truly needs to. Most of the time, it simply speaks quietly and waits to see if anyone is listening. In the case of blood pressure, that quiet voice can start speaking as early as the 30s, long before it becomes something loud enough to demand attention in an emergency room. The 3 signs described here, the recurring morning pressure headache, the strange and unexplained vision changes, and the fatigue paired with a racing heart are the earliest words in that quiet conversation. Paying attention to them and following up up with an actual blood pressure reading rather than a guess, is one of the simplest and most powerful things anyone can do for their long-term health, regardless of age. This video is intended for general health education and awareness. It is not a substitute for a diagnosis or personalized medical advice, and anyone experiencing these symptoms consistently should speak with a doctor and have their blood pressure properly measured. If this information was helpful, consider following this channel for more content dedicated to understanding the body's early warning signs before they become bigger problems.